Hi, everyone. Welcome to RCM Mastery. I'm so thrilled to be your trainer today as we walk through a highly requested explainer focused on Medicare eligibility criteria, along with some real-world billing scenarios. Our material today is drawn directly from the AR Learning online database, covering the very real questions that revenue cycle management professionals face every single day. We're going to take this nice and slow, really focusing on clear, actionable rules that'll strengthen your AR practices. So let's get right into it.
Okay, let's dive into this core question. Who exactly qualifies for Medicare? Now, in the world of medical billing, eligibility is often way more complex than a patient just blowing out 65 candles on a birthday cake. If your AR team assumes age is the only factor, well, you're probably seeing some unnecessary rejections and delayed payments. It is absolutely crucial to understand the exact foundational rules before we even look at a single claim.
Here's our roadmap for today's explainer. We're going to cover the foundation of eligibility, explore the 3 paths to Medicare, and debunk the 40 quarters myth. Then, we'll look at Medicare as a secondary payer and finish up with handling QMB policies. We're basically building the baseline rules first before we tackle those real-world edge cases. Let's jump right into Section 1, the foundation of eligibility. Before any health conditions or age factors are even considered, there's a mandatory, non-negotiable baseline requirement that every single patient has to meet to be eligible for Medicare. To be eligible, a person must be a U.S. citizen. Or, if they aren't a citizen, they have to be a permanent legal resident for at least 5 continuous years. And honestly, that word continuous is absolutely vital here. If someone doesn't meet this foundational citizenship or residency requirement, their age or medical condition won't override the system. It's a strict baseline. This is step 1. Moving on to Section 2, the 3 paths to Medicare. Once a patient meets that foundational citizenship or residency requirement we just talked about, they have to qualify through one of 3 specific paths. They only need to hit one of these 3, but they've got to meet it completely. Let's break each one down. Path number 1 is the most common and definitely the most widely known, reaching the age of 65 or older. Once someone who meets that residency baseline hits their 65th birthday, boom, they become eligible for Medicare. In your standard day-to-day billing scenarios, this is the path you're going to run into the most. For the second path, disability, the specific timeline is a big deal. A patient can qualify if they're permanently disabled, but wait, that isn't the end of the rule. They also have to be receiving disability benefits for at least 2 years. 2 full years. It's a very strict timeline that must be entirely satisfied before Medicare eligibility actually kicks in. And the third and final path applies to patients facing end-stage renal disease, which we usually just call ESRD. This means the patient has permanent kidney failure that actively requires dialysis treatment or a kidney transplant. So if a patient meets the foundation rule and has ESRD, they qualify for Medicare totally regardless of their age. All right, Section 3, the 40 quarters myth. Let's pivot into some real-world scenarios, starting with this incredibly widespread misconception.
So, a user in the AR Learning online community asks this. If a person is 18 years old and pays taxes for 10 years, at age 28, will he get Medicare? It's actually a fantastic question, mostly because it reveals a really deep misunderstanding of how the tax system actually interacts with the eligibility rules. The whole confusion really stems from the number 40, specifically 40 quarters. See, in the U.S. tax system, working and paying Medicare taxes for 10 years equals 40 quarters. Because of this, a lot of people mistakenly believe that the second you hit that 40-quarter milestone, you just automatically unlock Medicare coverage, no matter how old you are. But here is the absolutely crucial takeaway. Paying Medicare taxes for 10 years, or 40 quarters, does not grant early access to Medicare at all. What it actually does is earn the individual, premium-free Medicare Part A coverage once they finally turn 65 and meet that standard age requirement. They still have to wait. There's literally no shortcut to eligibility just because you paid your taxes early. Here's another real-world scenario from the community that builds right on top of that misunderstanding. A biller asks, okay, a person is 27 years old, has no disabilities, but is ready to just pay the Medicare premium out of pocket. Is he eligible? In this case, you've got a patient who just wants to bypass the rules entirely by throwing money at the situation. The answer here is a definitive no. There is no early buy-in program. Simply being willing to write a check for the premiums won't magically grant an individual eligibility. Without meeting that citizenship or residency baseline we talked about, and without hitting the age, disability, or ESRD criteria,
that 27-year-old is just not getting Medicare. It's so essential your billing team understands that eligibility simply cannot be purchased outside of the established rules. Moving into Section 4, Medicare as secondary payer. Let's deliberately dive into a complex area that I know causes massive headaches in accounts receivable. Those tricky situations where Medicare doesn't act as the primary insurance. You'll often hear this called Medicare secondary payer or MSP. Medicare actually serves as a secondary payer in quite a few specific scenarios. For instance, when a patient has an employer group health plan, well, that employer plan is going to pay first. Similarly, if the medical service is tied to an auto accident, workers' compensation, or some other liability coverage, those insurances are your primary payers. In these cases, Medicare takes a back seat and sits right in that secondary position. But hold on, because there's a really critical exception here. While workers' comp or auto insurance usually don't leave a patient with a balance when they actually pay a claim, if that primary auto or workers' comp claim is explicitly denied, well, Medicare might actually step in. As long as the services are medically necessary and meet your standard Medicare guidelines, Medicare can cover things after that primary denial. This is an absolutely vital fallback for your AR team to pursue.
Finally, let's head into Section 5, handling QMB policies, specifically when it comes to those pesky Medicare deductibles.
A biller in our source material mentioned they were once told that a qualified Medicare beneficiary, or QMB plan, only covers the Part B premium and pays absolutely nothing toward coinsurance or deductibles. But looking right at the CMS portal rules, that is completely incorrect. A true QMB plan covers the Medicare Part A premium, the Part B premium, the Medicare coinsurance, and yes, even the Medicare deductible. It's designed to be comprehensive financial protection for the patient.
So, the huge takeaway for your accounts receivable team is this. Because QMB plans must have a Medicaid policy acting as secondary insurance, you should always bill the claim to Medicaid. You literally cannot leave a QMB patient with a deductible balance. Let me repeat that. Do not bill the patient for Medicare deductibles if they have a QMB plan. You've got to adjust the balance or route it to Medicaid appropriately, adhering strictly to those QMB protections.
That brings us to a bit of a provocative question, one you should really use to evaluate your own practice. How well does your billing team truly understand these nuances of Medicare eligibility? Honestly, making sure your team grasps these distinct paths, the common myths, and the secondary payer rules is the absolute key to maintaining a healthy revenue cycle. If you found this video helpful, please hit like and subscribe for upcoming videos.